Hello, everyone, and welcome to the Operation Miss podcast, where we invite beautiful guests on so that we can inform our listeners how to have healthy pregnancies, show up to pregnancy their best selves, recover well afterwards, and just have a good womanhood journey in general. And today, I am so excited to have Dr. Kimberly Hoffman on the podcast. And I am so excited to have met her. It's not been too long, but I admire her already and just know that she has a lot to share with us. So, Dr. Hoffman, can you please introduce yourself to the people?
Sure. Thank you again for having me, Dr. Sylvester. It's been so amazing since I've met you. You have been such an inspiration, and I'm really, really happy to be here. So, I'm Kimberly Hoffman. I'm a physical therapist in Jamaica. I started out wanting to become a lawyer. Really funny. I I always thought I'd be a lawyer. I actually have an aunt that every year on my birthday, she asks me if I don't change my mind yet about PT. Like every single year until I eventually helped her on her journey and gave her some physiotherapy. And she's like, I'm happy you could help me, but still. So everyone thought I was going to be a lawyer, but then we have sixth form, which is like 12th grade. That's when we have upper sixth and lower sixth, would be 12th and 13th grade before we go to university. And in the 12th grade, I was just like, I don't think I want to be a lawyer. So I did one of those personality tests to help you choose a career, and top of the list was physical therapist.
Wow.
And then I didn't even really know what it was. So I began to do some research. And I remembered I had met a physical therapist who was like my big sister, because we had like a big sister alumna program at Immaculate. And I remember that she was a physio. So I reached out to her and she said I could do some voluntary hours at her practice. Now, let me tell you, her practice was like a luxury physio. It's like boutique physio. So, I mean, it was just so amazing. They were having like doing nails by the pool, and lunch was like fancy lunch. And I'm like, I could live this life.
Yes.
Like, I could live this life. So I was like, yes, I want to be a physio. Then my aunt was like, I don't think you really want to be a physio. So she took me to physiotherapy school, because we only have one physiotherapy school in the English speaking Caribbean.
Wow.
So she knew the head of department. So she took me to the physiotherapy school so I could meet her. And she's like, why you want to be a physio? And I went there like, oh, the life looks posh. And she's like, do you know that we have to like clear sputum and the chest physio? You know, all the other parts of physiotherapy. I'm like, I think I'll be fine. So she told me that I had to do more voluntary hours in like public sector. The first day at the hospital, I almost passed out, when I watched the my supervisor clearing someone's chest and it was coughing up the sputum. I was like, nope, I'm gonna do law school. So I went home. I told my mom, listen, I don't want to be a physio anymore. And she's like, you have to finish the voluntary hours. I was like, okay, fine. And I finished. And by the end, I really liked it. So I went to physiotherapy school, did 3 years there, did my internship. Then I got pregnant. Took some time. And then I had a job at the fertility management unit. So that was my first introduction to fertility and pregnancy and seeing what women were going through. It was really sad seeing women come through knowing that this is like, their final shot trying. So I really got an interest in women's health. I started to look into women's health. I had just had a baby myself, so I was particularly interested. I couldn't find much physios at the time in Jamaica who were willing to share their knowledge, share their experience. And luckily now we have like the melanated physiotherapy group where we can talk to other women. I didn't have that at that time. So it was just really going online and seeing what's out there outside of Jamaica. And then I started working for an orthopedic surgeon. And he was a he really shaped how I think and operate as a physical therapist, because in his space, I wasn't just operating as a physiotherapist, I was also his physician assistant. So I was seeing more holistically the care that went into a patient. I was ordering x-rays, I was like a part of a medical team and the glue on the medical team. So I really saw everyone's importance, and that kind of shaped how I operated as a physical therapist. He really wanted me to be a physician assistant and not a physical therapist. So we butt heads there until I was like deuces, and he was very sad. But it wasn't for me. I didn't want to be a physician assistant. I want to be a physical therapist. So I went on to work at Body Forte, which is a physiotherapy Pilates practice. A very nice one in Jamaica, actually one of the best practices in Jamaica right now. And it was there that I had more of an appreciation for using your core muscles and the pelvic floor and realizing the importance. And we got some credits that we could use, or money that we could use to do continuing education. So I did a course in I think it was called like Core Foundation from a physiotherapist, a pelvic floor physiotherapist in the US. I did her course, and I realized that her course, it was lacking in terms of what I could do with it. And then I just did my own research, used her information, what I found, and created my own program and treated myself. And then every mother who would come in, whatever they're coming in for, I would be like, hey, do you mind if I check your core? Check and they're like, no, sure, go ahead. And I would use the same program on them until I tweaked it. And then I created the Mommy Tummy Guide.
Okay, wait. Let's pause, because there are so many things, so many beautiful things that you talked about already. First of all, I just, when you said that you expressed your interest in being a physical therapist, you were exposed to a beautiful experience, and someone jumped in and said, hey, let me show you the real thing. And in one day, you changed your mind. Don't you think about, it made me immediately think about the TV and what it shows about childbirth, and how sometimes women will see and experience one, they will think of childbirth as beautiful. As children, we think about childbirth being beautiful, but then we get one show that shows a woman screaming or, bad things happening. You see this mad rush to the hospital after the water breaks. It's like you get in your head that you can't do childbirth. You can't do labor and delivery the way that that you thought you could when you were younger. And unfortunately, when women make that decision, sometimes it carries them through their pregnancy. When they get to the point where someone says, hey, you've been pregnant a really long time, you're not going to be able to make it, they believe it because of the belief they had going into the experience. And so thank God you were giving that, your mom was like, no, what you started, you're going to finish. And I just think, what if we had providers like that who reminded women that what you started, you can finish? They don't want to intervene. They don't want to give you the second best option for delivering your child. They double down on your ability to go the distance if it's safe, right? Now, if you had gotten to the end of the experience and said, you know what, I really don't want to do this, then you would still be making a decision, but it would have been an informed one. And then
it's unfair. It wouldn't have been based unfair. And the good thing with my mom is that she didn't say you have to be a physiotherapist. She said you have to finish your voluntary hours. That's all she said. She's like, okay, I understand how you feel, but you have to finish your voluntary hours. That was it. There was no pushing about. So I didn't feel like, oh, I'm going to have to be a physio when I'm done. It's just like, all right, then fine. I did sign up for this. I did tell the people I'm coming for 7 days. I'm going to come for the 7 days. So, as you're saying how what you've heard and seen about childbirth, how it affects your birth, that's the same thing for me because I'm really small. So when I was pregnant, I was like 95 pounds. The highest I got in my pregnancy was 110.
Wow.
So everywhere I go, everyone said, how are you going to push out that baby? How are you going to manage? So I was terrified because I'm like, everyone's telling me how are you gonna have this baby? How are you gonna push out this baby? Like once they saw me, that's all they said.
Yeah.
So it was a lot of fear around delivering my daughter, a lot of fear. And my pregnancy was beautiful up until exactly when the point where I stopped working, because I did my internship pregnant. So I would have finished my internship beginning of the end of August, probably the first day of September. And the day after that, I had my first preterm contraction, and I ended up in the hospital. And they're like, yes, you're actually having contractions and you're starting to dilate. And I was like 7 months.
Wow.
So I was scared because I'm like, why is this happening? So they put me on bed rest and they gave me that injection as a steroid injection to speed up the development of the lungs. And so I was terrified. I was just like, oh my gosh, see, I really can't do this. Like my body's too small. My body's not capable. So I went through that phase and it was really scary. And I never got out of that fear. Like I never should that fear. So I was constantly having contractions. Now, with all I know now, it was probably Braxton Hicks. It was probably normal things that were happening. But because I was told I can't do this, everything seemed like something was wrong. Right. So I was just operating from fear. Actually, having my daughter, the actual delivery lasted 5 minutes. 5 minutes. 5 minutes. 5 minutes. And it's like, it's a really, really funny because what happened was the night before I was having contractions in the night. And I said, because I've been to the hospital like 3 times before that. And I said, come hell or high water, I'm not leaving this house until the baby is coming, because I'm not leaving the hospital without a baby. It's like I was feeling the contractions, but I stayed at home. I walked around, but this wasn't because I knew that was the best thing to do. It was because I was so tired of going to the hospital and coming home without a baby.
Yeah.
So I called my doctor in the morning and explained to him what was happening. And he's like, no, you need to go to the hospital. And I was like, all right, fine, I'm gonna go. But any other have the baby, I'm staying there. They can't send me home. I went, and when I got there, they told me I wasn't dilated. I was like, they said it was still at the same, I think it was about 2 centimeters. It was still the same 2 centimeters that has been from I was 7 months. So I told them, okay, I'm not gonna leave. I'm gonna stay right here and we'll see what happens. So I wasn't on a bed or anything because, you know, the healthcare system in Jamaica, this was a public hospital. It's nothing like the US at all. So I'm like outside in the sitting room and I couldn't sit. So I was just walking along the corridors, up and down, up and down. Luckily, this was where I did my internship. So I was familiar with the nurses. So I remember saying, okay, I can't walk anymore. Can I just go and lie in that bed there? It wasn't like a bed that you're supposed to get, but because I knew them, they're like, yeah, you can go lie down over there. And I went and I was lying on the bed. I was like, no, this baby is coming. I'm like, this baby is coming. So I went in and she's like, but I just checked it. I'm like, all right, just check me again. And she checked and I was fully dilated.
Wow.
Fully dilated.
Wow.
She said to me to just walk over there, gently walk to the bed over there and change into your nightgown. And by the time I changed in my nightgown and went on the bed, she came and the mucus plug fell out.
Wow.
And they were like, wheel her into the delivery room. And by the time I messaged my aunt to say they're wheeling me into the delivery room because I was there by myself. Nobody else was there because they told us I'm not having a baby. So I'm like, they're wheeling me to the delivery room. Tell them to come. And by the time I was in there, I was like, baby's here.
Wow.
Baby was here.
Wow. Isn't that so? So we're just going to play back just a little bit of it because sometimes women are at a certain dilation and a certain, thickness of the cervix, and they are afraid because they're like, my body's not doing anything. My body's not doing anything. My body's not doing anything. And it's like, no, there's so much that goes on under the surface. Your body is doing just what it needs to be doing.
Because that's the same day. That's like a few hours apart between being 2 and fully dilated.
Yes.
It happened like this. And I know it had to do it. I was walking. I was walking the entire time. I was leaning on the wall. I was doing all the stuff that I'm telling patients to do now. But I didn't even know that I was helping the process. I just couldn't sit any longer.
That is so beautiful. So
But
we hear you saying move around as much as possible, right? As you can, and then stop when you can't. That's the thing. Our body will tell us exactly what
that's
to do.
exactly what I was about to say. It is just like this was just instinct. I was just doing what my body was telling me to do. I had no information. I had no doula. I had no one there with. I didn't even have a person, meaning a family member, anyone. I was by myself the entire time. And it was just because I decided I was going home.
Yeah, yeah. So why, can you tell me, you said that you were in the hospital on bed rest. How long did you stay there and what made them say, okay, you can go home?
I stayed there. So you mean at the 7 month mark? So
Yeah.
I stayed there a week, and they just said I could go home because they wanted to just give me those steroid injections, watch that I was okay, and the contractions weren't progressing. So
Gotcha.
once it wasn't progressing, they're like, you can go home.
Okay.
And then I came back because I had the contractions again, but this time I had to stay about another 5 days, because the baby was in distress. So her heart was going up. So they just want to make sure that everything was okay. And then the funny thing, they told me that if she didn't come naturally by, I think it was the Monday, they would have done a C-section. And she was born the Saturday.
Wow.
So yeah, I went home and my grandma's like, drink up this time tea. So I had time tea and I was dancing and I'm like, okay, we're gonna do this. We're gonna do all the things so that the baby
Mhm.
comes naturally, so they won't cut me on Monday. And I was saying to him, you don't need to cut me on Monday. I'm not even close to my due dates. Because my due date was actually November 8th. And she was born this Saturday, which would have been October 29th. So the Monday would have been the 31st. So I wasn't even close to my due date. So I was like, no, I don't think you need to cut me. I think I can, get through. But then
Yeah.
a part of me was scared that my body couldn't handle it. So there was also that.
It's really good that your baby just came because I don't know. I think we all get into that fear. If it's implanted in us from the beginning, that's what I'll say.
Mhm.
Then when something goes wrong, it creeps back up. It's not like it just, you all of a sudden feel like, no, my body can do this. That's
Yeah.
hard to do, especially if something seems like it's going abnormally compared to what other
Mhm.
people have experienced, which is what we are typically compared to.
Right. So the funny thing is that when I had my daughter, it was one of the worst days to have a delivery in Jamaica because the doctors were graduating. So all the interns would have been at graduation. So the hospital would have been short staffed because in Jamaica we rely heavily on interns to staff the hospital. So there were no interns around. And then a lot of the head doctors, they're part of the graduation team. Because remember, it's only one university, right? So my doctor was the dean of medical science. So he was handing out certificates at graduation. So the hospital was empty. The midwives were running everything. And remember, they didn't believe that I was going to have a baby. So I didn't get any fluids. I didn't get any IV. I was not connected to anything. Because in no time, I went from two to fully dilated. So when I was in the delivery room, the delivery nurse was like, "Oh my gosh, you don't have any fluids. The contractions are slowing down." And I'm like, "What do you mean? The contractions are slowing down?" So she's like, "You're not having strong enough contractions to push out the baby." So in my head, I'm like, "We wasted all the contractions last night because those certainly were strong enough to push out the baby." So she started tapping my tummy to bring on the contraction, and that was very painful, by the way, because it was already so uncomfortable, and she was like tapping, but she's like, "Don't worry, you can do this," So it's very reassuring. So I was like, "All right." So I remember now the baby's almost due. The birthing canal, so she's like, she's almost there. The head is there, but like the contractions are weak. So like, I am a physio who just did my internship in peds. So I'm like, oh my gosh, if this baby gets stuck in the canal, all the things that can possibly happen. Again, fear. So I'm like, what do you need me to do? I'm like, anything you say, I'm gonna listen because I was like terrified. Like, you're gonna be fine. So once the head got through, she's like, I'm gonna help you because I have to help you at this point. So she grabbed onto the baby's head. She pulled her out with me. And my daughter was born with like one fingerprint right here, one fingerprint right here. Elvin took her out. But again, she was out in like 5 minutes. It was like 5 minutes. So in that moment, it felt like I couldn't do it. In that moment, it felt almost impossible. But in reality, it was only 5 minutes. It was
Yeah.
only 5 minutes. So if in that 5 minutes I was like, no, cut her, cut me, take her out, giving up like a lot of persons do because they really believe they can't do it. It would have been a completely different outcome. And she was fine. Other than her fingerprint in her forehead that went away by the time she was, you know, 5 months or 4 months or whatever. And it was cute. It was like a little birthmark. It was cute.
Well, I have a question just so that we understand the difference. So here, there are certain protocols, things that happen as soon as someone comes into the hospital, unless they say no to them. How is
Mm-hmm.
it in Jamaica? How is it in Jamaica? How is it different other than the decreased amount of staff? That was funny.
I really don't know the exact protocol, but for one, I should have had to get an IV fluid. For one, that's usually what happens. Because even times before, when I went in for the scare, they started the IV right away. But they didn't have anybody to try the IV.
Right.
So there were no doctors. And then apparently, they had like two moms in operation theater. So the doctors that were available, they were all in the operation theater. So they doesn't have anybody to do it. Really, that's
Gotcha.
really what happened. Like I chose the worst day. It
Yes. But it was actually the best day because you got to do
was
it,
the best day.
like you said,
I didn't.
uninterrupted.
I had a natural birth. It was 100% natural. Was it painful? Of course, it was painful, but it wasn't. It wasn't impossible. It wasn't like the worst pain. I think I felt worse pain, like toothache. That was worse than that. So I and if when I have my next child, I'll do it the same way. Completely natural. I The body is capable and the body is amazing. It is. And I realized that most of what I experienced it was rooted in fear. It was rooted in fear. And if I can help mothers to just believe that they're capable, then I believe that, you know, we've we've done something great. And that's really what I do. I really encourage mothers a lot. Like you can do this. Your body it was designed to do this, to live, and it has like my experience really shaped how I interact with my mothers because I have a hilarious story. It's like so funny, and they love it and they do feel hope through it. So
Yeah. Yeah, you do. Okay, so your birth was beautiful. That was wonderful. How was your postpartum experience? So I know that you talked about coming up with the mummy tummy and
right.
checking scores and things like that. Is there any relationship between your experience and the actual creation of your program?
Okay, yeah. So before we get to the diastasis, after I had postpartum depression, so I went through a period of just not feeling like myself. It was just it was just a feeling that I didn't know was there until it left. So when it left, I was like a year later, and when it left, it was just like, huh, like you ever had like something on you and you didn't realize the onion was off? That's exactly how it felt. So going through it, I mean, some people tell me that I'm acting different, but I couldn't see it. But when I was no longer in that space, and it was like, hmm, yeah, I did feel you. I realized how I felt before. But in addition to that, when I went to, so we have 6 weeks clinic here in Jamaica where we take our kids to get their shots. So at the 60 clinic, because it's at the health center, they also do our pap smear for the mothers. So I didn't want to my pap smear there because I had my own private doctor, which is a public system. So, but I did it because I'm like, hey, it's free. Let's do it. When I was in the pap smear, the lady was like, oh, it's really long. So I was like, what are you doing? Why is it taking so long? And she's like, oh, she saw a little thing, but she took it out. I was like, a thing? What do you mean by a thing? She's like, oh, I think it's like remains from your placenta, but I took it out. What do you mean by remains from a placenta? I had my baby 6 weeks ago. What do you mean? So she's like, no, man, it's fine. I took it out. Didn't believe that. Didn't buy that. So I called my doctor. I'm like, hey, I need to come in for an appointment. And, I went in. I actually didn't go in when I wanted to. I had to wait a few more days. So we're talking about like 7 weeks now. Went in, did an ultrasound. I have a huge placenta in like the healing. Scheduled me for like emergency BN. But I had my baby with me, and I don't know if you understand Jamaica, but like we have parishes instead of states, small country. But I was living in Clarendon, and this doctor was in Kingston. I had my baby. There's no way I could do the surgery without I had to take her back home. I was like, I will do the surgery first thing tomorrow morning, but I have to take my baby home. So took her home, and it was just hard because it was my first time away from her. So she realized that something was happening. She was bawling. I was bawling. Like I bawled the entire night. That separation anxiety was real. Went in to do the surgery. I have to share this part because with all that's going on right now with Roe v. Wade, I have to show persons how this can affect someone, even someone who doesn't want to have an abortion. Abortion is illegal in Jamaica, right? I went in the morning to do the DNC with my doctor. My doctor is the dean of medical science. He's one of the top gynecologists in Jamaica. Can't get any better than that, right? And I have a letter from him to do my DNC, which would have been a much needed medical procedure. I went in and the receptionist said, I can't do the DNC. I have to see their doctor there for trials. And I'm like, no, ma'am, I already saw the doctor yesterday. I got this letter to do the DNC. He tore my letter up and threw it in the bin and told me to go downstairs. I was already at a 10. I was
Yeah.
already at a 10. I called my doctor, told him what was happening. He's like, no. I'm like, I'm so serious. This is what's happening right now. And he's like, all right, just do what he's saying while I get someone to come and rectify the situation. Went down for almost an hour before I could do the trial thing. Saw the doctor there, told the doctor that I saw Professor Fletcher. This is an intern. So I'm like, Professor Fletcher is my doctor. And he gave me a letter to do the DNC this morning. And of course, she's an intern. She signed off on her papers. He's like, what? Like, why did they send it to me then? I'm like, I have no idea. She's like, go back upstairs to do the surgery. Went back up. The lady took me by my hand and took me back downstairs. The same lady. I was only able to do the surgery when they called the head. I don't know what it's called in Jamaica, the CEO something of the hospital. He had to come for me to get to that surgery that morning. I didn't know what was going on. I didn't realize at the time what was happening until I got on the inside when the nurse said to me, how far along are you?
Oh my gosh.
And then I realized, oh, they thought I was having an abortion. And that's why I went through all that hoop. Like, I could have died in that process.
Yes.
And it
Yes.
would have been just because someone thinks they have the power to tell someone else what to do.
Mm.
It was so heartbreaking. It was so heartbreaking. When I said to the lady, what do you mean? I already had my baby. And she's like, she's alive? I'm like, yes, she's very much alive and waiting on me at home. And she's like, so, and then she just said, okay. And I was like, you would know what's wrong with me if the lady outside didn't refer up to the referral that I got from the doctor.
Right. Wow.
So when people think of Roe v. Wade, they think about rights. They think about it very in a box. It's not in a box. It affects everyone. Even persons not going to have an abortion, because when something is illegal, persons will think that, hey, I don't want to be a part of this thing that's illegal or whatever. And then persons who should get certain care won't get the care they're supposed to get. So it's a very thin line when you're trying to be so rigid and strict what women can do with their bodies.
Yeah. Yeah. The other thing about your story, though, that is scary is that if you had not decided to take the pap smear, then it would have been missed. And then if you had listened to the lady who said, oh, it was there, but I got it, it would have been missed. You saved your own life.
Yeah.
You know what I mean? By following up on what you knew and following your intuition. And that's what I always tell women. If you follow your intuition, even if nothing is wrong, you'll be glad that you did. Right? Because what if you had gone and they said, you know what, nothing's in there, you're fine. That's great.
That's
it
great.
Just one separation from you would have been separated from your baby and then you would have come right back. And so it's worth it to follow what we believe. Now, I also want to ask you, did you feel weird within the first 6 weeks? Anything like your heart rate going up? Were you checking your temperature, see if you had a fever?
I was doing nothing. I was just at home being a mom. The good thing is I had decided straight off the bat, because remember I was pregnant in a very weird state, because in Jamaica, we don't have a lot of posts, right? So a lot of persons were like encouraging me like to apply for jobs. They didn't know I was pregnant, because for most of my pregnancy, nobody knew, because I'm tiny, I'm in scrubs. Nobody knew I was pregnant, but I was a pretty good intern. So they were like, you apply for the post. And I wasn't applying for the post. I'm like, why are you not applying for the post? But I knew that I would not have qualified for maternity leave in the time that I would get hired and have the baby. I would be working 2 weeks. And I didn't want that for myself. And now I'm so grateful, because if that were the case, going back so quickly with placenta remains, I probably wouldn't have made it.
Yes. So what I normally hear is very funny that you said that, because there's a girl who actually has created this device where they pick up on postpartum hemorrhage peripherally. So like essentially, you know how if we're losing blood, our body will send blood to our core to protect our core organs. Well, they developed a device that picks up on the peripheral vasoconstriction. So it's really, really cool. But her story is that she also had placental remains. She was working and felt like she was going to pass out, kept working the day because, she just felt like, well, maybe this is, and I got to finish with the day. And, we have competing factors that may sometimes say, let me just delay what I feel. Not going to follow my intuition because I have to work, because I have other kids, because I don't want to be separated from my child, all the reasons. But you are proof positive that there's a completely different outcome when you just follow your intuition. And then continue to follow up instead of saying, okay, they ripped up my paper, I'm just going to go home, forget about,
Going home that day. I was not going home with the placenta in me, like, no way.
That's right.
You have to fight me. Because I was not going home. I was aware of what that meant. I was not going home.
But some people are not. You know what I mean? Some people are not aware of what that means. I'm so grateful for your knowledge base, because I've heard, people don't even know that the placenta gets delivered after the baby. And it is not. So what is great is that there are now so many people out there giving education so that women understand the importance, because, you do meet people who are like, well, the doctor didn't listen to me, I'm just not going back. Or the doctor didn't listen to me, I'm not going to worry about it. And it's like, no, that's what's costing us our lives.
Is what
And it's, when people are thinking about the mystery of death, and here in the United States, there in Jamaica, why are women dying with pregnancy related complications? And a lot of the answer is that that's right.
it is a lack of knowledge. But it's funny because I remember a person saying, "Oh, you need to sue the hospital. How could they not get all the placenta out?" And I said to them, "No, I wouldn't, because the nurse, I remember after delivery, she did the massage, the frontal massage, and I was like, this is so painful. Do you have to do this?" And she's like, "Yes, I have to do this. I have to make sure that all of your placenta comes out." And she did it 3 times. So she did her job. It's just that, and in reading, I learned that some women, how their insides are shaped, it's harder, and some pieces they do get stuck, regardless of what they do. So, like, knowing this now, that the advice is that next time I have a baby, I should check it, to do the ultrasound to make sure that all the pieces are out, because that's just how I am.
Yes, that's how you are. And I love that you said that. We have to see, what is it that's unique about our bodies that could cause us to have issues with pregnancy, with delivery. I love that you said that. For us, we are always encouraging our moms to ask, can I see the placenta? Have you checked and double checked and made sure that you see everything? Just because it's okay to double check. It's okay to double check. And then you going into your next pregnancy, they're going to double check, right? They're just
double check. I'm sure they're going to make sure all the pieces are there.
Yes, because suing is not the answer all the time. It's not the answer. And I think that that's what some hospital systems are afraid of, that people will turn around and sue them. But as you can see, people are dying and nobody's getting sued. So the answer is to just prevent the death. We can just ask for what we need. And that way we can rest assured that we're okay before we're gone,
Yeah. So I am like I'm like made for women's health, because I have all the stories.
Yes, yes you are. Yes, you do. Yes. I just knew that you were going to say that lady was checking you and then she checked and found diastasis. And then you were like, no, she checked and found. Yeah. I thought that you were going to say that she checked for everything. You know how they're supposed to. And not that she didn't, but during the 6-week visit, 8-week visit, whenever.
So it was just, I think it's just to catch. It was like a system put in place to try to catch cervical cancer in Jamaica, and they just do that at the clinic once they get the moms, because the moms are gonna come to get the shot. So since they're there, let's just get that pap smear. That's really all it was. They didn't check anything else. They didn't ask me how I was doing. It was just to site my cervix. That was it. That was it. So nobody caught my diastasis recti. Everybody's like, "Oh, you snap back. You look so skinny again." And I'm like, I didn't even really put on any weight in the first place, so of course I'm gonna still look skinny. So I really didn't know I had diastasis recti until at that year mark, where I'm just like, you know what? I'm ready to exercise and try to feel like myself, because I started to feel like myself again. And I started exercising. I created a program to work on my tummy, because it was all flabby with loose skin, because I had a baby. Natural things, like not in a bad way, in a way that your body looks after pregnancy, which is completely fine. So I decided that I wanted to work on it, get it to look a little more firm. I wanted to feel better in my core in terms of lifting and doing things. I'm a physio. I'm lifting patients. I'm doing these things all day, and I just wanted to feel better. And that was really where I started from. And started working out. And I remember my mom said to me, "You're pregnant again?" And I'm like, "What?" And she said, "Your tummy looks bigger." When your mom says it's like that's so I'm like, that's crazy, because I thought bigger too, but I'm like, maybe because I'm working on is bulking up with muscles. So I did a research, and I did I was saying I had diastasis recti. But the thing is, as a physio, that was even one of the questions on our final professional exam, was diastasis recti. And I remember treating probably about 2 or 3 patients in the clinic. And I'm like, no, my tummy don't look like their tummy. Because the case that we would have seen in the hospital, it would have been extreme. And I wasn't an extreme case. I'm like, I don't think so. But I did the test, the self test, and I'm like, it is. It's
Yeah.
diastasis recti. It was like 3.5 finger spaces straight down the middle. And I'm like,
Did you say 3.5?
mm-hmm,
Wow.
the middle. And I was like, oh my gosh. And didn't have a clue, And then remember, I had been working, by now I was working at Body Force at the Pilates studio. So we're doing heavy core stuff. So I'm like, I could have been doing so many things that I wasn't supposed to do. And I was still in that fear mindset because I didn't know much about diastasis recti. And now I'm reading all these things that say, know this, know that, know this, So I'm like, oh my gosh, I've been all the no's. So of course there was a lot of fear, but with time and with information, you realize it's not no, it's not right now. And that's what I like to tell my patients, because no just sounds so heavy, like you cannot. It's just like
Yeah.
you can't do it right now. You have to take it in stages, and as you build strength you can do more. And that's what I did. I started to take it back to just breathing and working on breathing and building my strength there, and then doing all the stuff. So and then there's some exercise that I still don't do, and it's not because I think I can't do it, because I never like them anyways. So now more ways of strengthening your core. You can skip those. So
Absolutely.
yeah.
Now, before I veered you off track, because I just want to see how you incorporated it into your practice, you said that you were at the Pilates studio, you learned a lot about the core, you're checking all these moms now, which is wonderful. Have you incorporated Pilates, any other parts of Pilates into your program or what you learned there?
I did. Because Pilates is heavily circulated around breathing and incorporating the core and pelvic floor. So it was easy to transition. It was just taking the basics of Pilates, which is the breath work, which is the core activation and pelvic floor activation, and starting that as a basically foundation of the program. So Pilates played a heavy role in the creation of the Mommy Tummy Guide, for sure. But it was the Mommy Tummy Guide, which we should speak about now. I think we're here now. It is like 20% exercise. 20% exercise. It is more about accepting yourself. That's the first step. It's accepting where you are on the journey and learning in acceptance. I use the ACT, acceptance commitment therapy, to create that first step. And it's really for mothers to understand that a lot of what you have as your values, or where you're seeing the lens that you're seeing life through, was created by a society driven to exploit you through commercialism. And when you can look at your body and look at it as the good that it is, this amazing body that can stretch to accommodate a baby, that can deliver babies upon babies and get back to work and do all the things. When you can see your body as something great instead of something broken, we are halfway across the journey. We are halfway across.
Yes.
And when I see mothers go from hating the tummy and being disgusted with their bodies, because the first session, it's always tears. It's always bawling about this body that they now hate, that they have to live with. And seeing them go from that to thinking that their body is amazing and realizing that their body is amazing, it's just such a great feeling. So these are affirmations. We use a lot of massage, self-massage. I have mothers who don't even touch the tummy because they're so disgusted by it. And for them to go from that to rubbing and touching and using oils. I make oils, so I give them oils and body balms that smell good, so they love to do it, trick their mind because they have this nice smelling thing on the rubbing. And to just see them start to appreciate the bodies, it's just so amazing. So we go from there and we go into what we can change right now. So, what we can change right now to help you feel better about yourself. And just learning about the breathing, learning about the core, exercise that literally the last step, the seventh, is an 8 step and exercise is 7 steps. So you know how many other things we go through before we actually focus on exercise. And then they realize that wow, there's so many things that I can do within my power without needing a lot of time that I can help my core. And it's just so beautiful to take women through that transition and just seeing them. And at the end, I don't promise anybody a flat tummy. I tell them from day one, I don't owe you a flat tummy and you don't owe me a flat tummy. Like, and half of them never had a flat tummy to begin with. So I'm like, what do you expect? So, just feeling stronger, feeling better
Yes.
about your body, feeling better in your body. That is my goal. I want to have achieved that. I have done my job. And, I've had mothers who that's not what they want. And I tell them the option. You have surgery. Surgery is an option. And, I never knock surgery. I hope they accept themselves as they are. But if they feel better doing surgery, then by all means, do the research, get physio after surgery for sure, and do what makes you feel best. Really.
I love your program because for some women, if you fix the tummy
Mm-hmm.
and then the tummy comes back after menopause, but you've never fixed
The
the
mind.
mentality. Oh my goodness. What a beautiful gift of life and confidence you're giving to countless women. And we all need it. We all need it because I just think that the way that childbirth was designed and the life after, was meant to be beautiful and restful and empowering. But we see women who are experiencing the exact opposite. And it truly, prior to Operation Mist, I worked with moms just like you.
Mm-hmm.
And I would see how beaten down they were, how
Yes.
they didn't believe in themselves anymore. And it doesn't just stop in the body. It impacts every area of their lives, their marriage or other relationships, their ability to work and to get promoted and to mother and to interact with other people. And it doesn't have to be that way.
It doesn't. I remembered a few turning points in my life because I felt that way. Like that's what I said. This. I remembered how I felt when I got pregnant. It was the worst feeling for me. I was not happy to be pregnant at all. That was never the life I envisioned for myself. And I, of course, weighed my options whether I wanted to actually go through with it. I'm happy I did. I'm happy. I'm really happy I did because that decision shaped my life. And I'm happy with where I am right now. But getting there, understanding that life is skewed for mothers. It's not the same linear path. It's already skewed for women. It's even worse for a mother. And I remember my first job interview, the question was, who's going to take care of the baby? And I was thinking, I'm like, my daughter's father did an interview, and I'm sure they didn't ask him that.
Exactly.
They didn't ask him who was going to take care of the baby. I'm sure. I remember when they were renegotiating my contract when I said I didn't want to be a physician assistant. I only want to be a physiotherapist. And they were cutting my pay. And I know they were doing that. And when I said I don't like this and I don't think I'm gonna take this option. And they were basically saying to me, remember, you have a child.
Wow.
I quit, of course. I left the job. And support is very important because I could do that because I had my parents, I had family. I could be like, hey, yeah, I'm going to just write it back. I'm just gonna trust in my abilities And that was extremely hard to do after pregnancy. It was extremely hard because now you weren't making decisions just for you, you know, you're making decisions for you and a child. And I remember my turning point was saying to myself that I don't want my daughter to ever feel like she's limited, regardless.
Amen. Amen.
To be inspired in my journey. In the heights of the pandemic, I told a very good job, deuces, because it did not make sense, for me and for my family. And everybody was saying, you're crazy. And I'm like, you know what? That's fine. I've been crazy before with less, and I was fine. So I'm gonna continue being crazy. I'm gonna continue pushing the boundaries. I'm gonna continue stepping out of the box that everyone's trying to put me in. And what's the worst that can happen? I move back to my mom's house. Okay. I'm okay with that. I weigh the risk, and I'm like, you know what? I'm okay with that.
Yeah, yeah.
With that.
Can you pause there for a minute? Because that is a theme across and I don't know if you realize that even across this conversation, you weighed the risk and benefits. You decided I'm okay with that. And I think if we just do that, take the time to do that. The problem is society is so fast. We are so fast. And when I realized something was wrong during my pregnancy, I was not working. I had actually stopped working because just with the pandemic, I noticed that a lot of the patients were really stressed, and them being sad made me sad. And them being separated from their husbands for the first time in 60 years, or them having stage 4 cancer and only 2 of their 6 kids could come into the hospital, that was stressing me. And I was like, I'm coming every day, breaking rules so people can stay together. Why not just take off? But I realized that had I not taken off, because I was working, girl, I loved working, loved like moving. I didn't have any issues, I thought, but it was that ability to pause and really listen to my body that made me say, no, let me go in. It was me not having to go in on Monday morning to work that made me able to go to my midwife. Like, we have to build in the pauses to think, to reflect, to decide. And a lot of women are thrown into situations where a decision has to be made now. And so let's not let ourselves get in that situation. We need to decide now, what are the benefits? What are the risks? Where am I going to feel okay? Like making a decision and saying, this, I'm okay with that. I'm okay with the results.
Yeah, and that comes down to your values. When I realized living life according to other person's values, that is where I'm like, do I even want this for myself? And you realize, no, you don't. So once I got clear about what I value and what's important to me, then everything becomes okay. I mean, we are taught to chase all these things, the big house, the big car, all these things, they come with a price. And that price is usually your sanity, your peace of mind, your ability to spend time with the people you love and do the things you actually enjoy. And if you're willing to do that at that expense, I'm just like, go for what you want to go for. But I'm not. I want to say on a Sunday, let's drive to the beach, go to the river, and not have all these extra commitments that I don't even care about. Like, I'm doing it because you're asking me to do it. Like, I truly don't care about that. And I used to say yes so much, to be everywhere, to do everything. I mean, I was growing in this space where everybody wants to know about diastasis recti. So everybody was inviting me to all these talks, and I was doing all these things for free. And because I believe I need to do this for all these mothers. And I'm like, yeah. But at the same time, I have my daughter, my husband at home, and they need me too. No, I give free information on my Instagram. I give free content. I have a radio show. I have all these things and all these spaces for women to get information. I don't need to burn myself to the ground for the cause. I don't. And it doesn't make me selfish. It doesn't make me any less passionate, or it doesn't mean that I care any less about these women and this message. It doesn't. But I can't do it burn to the ground. I can't put them burn to the ground. So I wish more women, and I used to use Supermom so much, and I don't. Because that's not a badge of honor for me anymore. And I don't think any woman needs to feel like they need to be super anything. They don't. And it
You
from
co-created with Christ. That was enough. Like
that
you co-created. You
that
brought life.
that is enough. That is your superpower, and that is all you need. And if more women could understand this, I see the burden on the women's faces every day. With fertility issues, the burden's on the woman. With carrying the children, the burden's on the woman. After, it's just so much burden. And if they could just only understand that it doesn't have to be a burden.
Yeah. Yeah.
And the more women are doing this, I mean, the moment that men understand this, women understand this, the world will be beautiful.
Yes.
Will be, well,
Yes.
it's already beautiful. I mean, minus give and take the horrible things, but it would be more beautiful, you know?
I completely agree. Oh my goodness. I completely agree. What a beautiful, because, I think that even when they slow down to do your program, I think that they start to really understand that life could be like that if we reassess our values.
And that's the step one. That's with the ACT, because we start with values. And I always joke with them because I tell them, this is my joke that I always give. So I would say, you know how long I've been trying to get a butt? Like, you know how many supplements and programs, you know how long I've been trying? But you know why I can't get it? Because I don't value it. So I get hyped up when I see someone who does a program and they grow a big booty, and I'm like, I'm gonna do that. I'm gonna do that because it looks good in the moment. It looks good. It's likable on Instagram. Big booties are likable. But I would never get that because I don't value it. Just like you won't get that flat tummy because it's not your value. Why are you doing this program? So that you can
Mm.
keep without pain, so that you can work without pain, so that you can feel stronger. These are things that you actually value. And if you can realize that this is the reason you're doing it and not for vanity reasons, then you can stick to the program. You'll never stick to the program like I've never stick to any of those booty workouts because I don't really value a big booty. I value strength. I value health. And if I look at it from that perspective, I can do all the things. But if it's ever just, I want a big butt, it's never going to happen.
Right.
And when they get that, when I get that light bulb going, they're like, it's true.
Yeah, it
It's
is
true.
true.
Because if they did value a flat tummy, they wouldn't eat the things that they know going to make the tummy big. They're not. They truly don't. They don't. And that's okay. Because everyone can't have a flat tummy.
I really love the freeing nature of how you interact with women. Because at the end of the day, like you said, you don't owe it to them. They don't owe it to themselves unless it's something that they truly value.
I can truly value that. I can help you get that too. But 9 out of 10, 9.5 out of 10, I've never met a woman who truly values that.
Yeah. Yeah.
Yeah.
Okay. So we're going to pivot one more time because we're going to talk about the maternal health issues or issue. I mean, it's everywhere, but how it is in Jamaica. And I mean, because I think when you reached out to me and told me the statistics, I was like, oh my gosh, we're sitting over here thinking our numbers are terrible. And you just, I found out, birthed the baby naturally in a place where the statistics are even worse. And so I am grateful that you have turned your story, your experience into something amazing. And because you have, now you have more access to women who will need you even before they run into diastasis, right? Like you'll meet women who won't run into complications because you're putting things in place. Women who placental remains being in their bodies won't be missed. Women who are not going to, at the end of their pregnancy, say, oh gosh, I can't do this, not realizing that their vital signs could tell them everything that they need to know about their ability. It won't tell you everything you need to know about your baby, but you can get your baby checked on. The hospital system has perfected that, right? They know what's happening inside of your body, so you're good. Right? And so what makes you want to remotely monitor in Jamaica? Can you tell me, like, you're here and you could stay right where you are doing the mummy tummy, being an amazing mom and wife. But what made you say, no, I want to bring something like Operation Miss to Jamaica?
Okay, of course, the numbers. The numbers are scary. I mean, we have this Vision 2030 plan from I was a baby. Just kidding. It's been a long time. And 2030 is pretty close, and I don't see them getting very close to this vision. And the number one thing is maternal mortality. I mean, the numbers are as high as 70 to 80. Normally, that was the numbers back before COVID. That's the pre-COVID numbers. And since COVID, it's like 213. It's the last measurement. And that's crazy. You
Yeah.
know, 213 is pretty ridiculous. And, you know, a lot of times it's preventable. A lot of times. But Jamaica, we have a problem. We have lots of chronic illnesses, diabetes, hypertension. You know, our numbers, they're really high. And my friend Dr. C, my colleague, he calls pregnancy the great revealer. So what's happening in Jamaica is that people think that they're going into pregnancies healthy, but they're not. And pregnancy is revealing that. But if you are monitoring from before pregnancy or right as you're pregnant, you'll be able to catch on to this pretty quickly so that you can get the intervention needed from early, you know, and then you could prevent these deaths. And I see that happening with Operation Mist, and I'm like, hey, if I can further help women, why not? Why not? Why wait for the government to not figure it out? Because they're not going to figure it out. And Dr. Sylvester, you've done such a good job at figuring it out already. And I don't even get the wheel. I can just use what you've been doing right here in Jamaica. And I just think it will be such a great thing for mothers. And it might be a hard sell, but I've been selling hard things for a while now. So I'm willing to do that. I'm willing to do that to show women that there is another way. You know, there is another way. And the more you know your data, I mean, I'm with my watch right now. My data has been stressing me out, but that's for another conversation. Like just realizing and just knowing the numbers might be scary at first, but once you know that this is happening, you can start to change things. You can start to fix things. Case in point, the first day I realized that my body battery went from 70 to 63 before I left the house. And I was like, what? What am I doing between that time? And I realized that my morning routine was just too hectic.
Mm-hmm.
So I changed it up. And it went down to only 2 before I left the house. So, you know, the more you know, the more you can adjust, the better you'll feel, the healthier you'll be.
Yes.
Right, less complications for pregnancy. And I can see it so clearly without even having the system itself, just by looking at my numbers that I have right now on the watch, I can already make these changes. You know?
I love that, because the thing of it is, throughout the course of the day, just like a car, if you hop in the car, you start driving, your gas is going to go down. Mm-hmm. But we know that on the interstate, we get better mileage than we do when we're right on the local streets. And so that's really what the watch is doing. It's helping us know, okay, well, everyone does drain, but not everyone is 5 at noon, right? Everyone doesn't go from 70 to 5 by noon. Something is happening. How can we adjust? And I love that, because it's so not about complicated. We have monitored over 100 women at this point, right? Mm-hmm. And people come on because they think it's because we're going to catch a complication. But the real thing is that, no, we're going to help you make healthier decisions along the way so you don't run into complications. Right? And so that's really the secret. It is that you will see this watch and you'll see it going off when you're drinking wine, when you're not pregnant. So you're like, wow, okay, when I get pregnant, even though I thought a glass of wine once a week was okay, I'm just going to not do it at all, right? Or when you exercise, you see how long it takes for you to recover from what you've done. Maybe While people say, oh, do the same thing your first trimester that you were doing before you got pregnant, you'll be like, I might just keep doing this until I get pregnant. And then afterwards, pick up something that's a little bit less intensive. So it is all about the course correction. I love.
It is amazing. It is amazing. Even for like eating late, I realized that when I eat late, the battery, it doesn't charge up as much during my sleep.
Yes.
You have to eat earlier because your body's so busy digesting your food, you're not getting to recharge. It's just simple things like that. Simple
Yes.
corrections.
And you're using it. And I think that the neat thing is that sometimes there are people like you who can do that. And they're just like, okay, I see it. I'm going to adjust it. You have other times when there are people who are either busier or they're just not aware or they don't use the watch as prescriptively.
Right.
Or just pregnancy makes things different. Like in our day to day,
Yeah.
we're pretty normal. If you go a month, your data is not going to change so much unless you change your routine, right? With pregnancy, it is literally week to week, month to month, appointment to appointment. Anything can throw you off. It takes longer to recover sometimes. And so it's really good, like you said, before you even get pregnant or right when you get on, to just go ahead and start committing to using your data to guide your decisions. It's a game changer.
It is a game changer. But I also appreciate that it's new. So it's a novelty. So my brain loves it right now. But I'm sure a few weeks from now, body battery, I didn't check it. So it would be good to have someone there checking it for me.
You accountable. Yeah.
Because when something is new, of course you're checking it. Of course you're into it. I have an Apple Watch in a drawer somewhere right now. But if you have someone that's holding you accountable who can say, hey, you're not wearing your watch, or hey, this is what's happening, then I can see where it will make all the difference,
Yeah. I am so grateful for what you're doing, everything that you're doing. And the women in Jamaica are going to be so blessed to have you. And one thing that you have said, and I love it, is that you work with providers who will listen. So now you'll have the data and you'll be able to help them help their patients better. And I just think, what a wonderful marriage, right? A healthcare team that all has more eyes on the mom without them also having to have eyes on the mom. You're doing it for them. And so it's beautiful. It's beautiful. Your vision is beautiful, and it is not going to be in vain. Now, Vision 2030 is actually going to happen in Jamaica.
It can actually happen. It can actually happen.
Yes, yes.
Yeah.
So I have final questions for you. Any advice? You've given such amazing advice all throughout. We've learned obviously a lot from your story, but two pieces of advice. One to moms or women, if you just want to go with women, because we know that not every woman makes it to motherhood or chooses motherhood. So let's say one piece of advice to a woman, other piece of advice to providers. What would you say?
I'm going to start with women. You're enough. That is it. You are enough. As you are right now, before you accomplish anything else, you are already enough. I mean, I talk to women, including providers, I'm going to get into providers too, who they can't offer this to women until they've done one more course or one more thing, no matter how brilliant they already are. They need someone else or something else to justify their ability or to validate them to do something else. I know women who are already pelvic floor physiotherapists, but they have to do something else before they can treat a condition that already falls under pelvic floor health. And I'm like, girl, just do it. Just do it. I mean, you already have the basic information to do it. So just do it. And the same thing for women in general. We always feel that we need validation from someone else. Men are gonna just do it with no knowledge, no course, no information. They're going to apply for the job, they're going to get the work, they're going to do it. You can. Okay, do not wait for anyone to validate. I don't mean like to be careless, and you won't be careless and you won't be reckless. You're a woman, you won't do that.
That's right.
You already know. You're not going to be second guessing something that you know you surely can do. You're second guessing things that you can do, but you just feel like you're not good enough to do it right now.
Wow.
And I'm telling you, you are enough. You are good enough. Go for it. Learn along the way. Learn along the way. You are fine. You are capable. Go for it. So
Yes.
that's what I want to tell women.
Oh,
And for my providers, take care of you. We give so much to others every single day. Our interaction, it's of a giving nature. You're giving your energy to every single patient that comes in front of you. You owe yourself to take care of yourself. Take your time out. Schedule it like you schedule patients. You deserve the time for you. And most physios, like I said, I did a test, so I'm sure we all fall under this same kind of personalities. I can't recall meeting a physio that I don't like. We usually have a similar personality types. We're giving in nature naturally. It is okay. It is absolutely okay to give yourself some time to replenish, to recharge your body battery, doing things that you enjoy. It's not selfish. It's okay to say no. It's okay to not bend and flex your schedule for that one patient. It is okay. And most times it is necessary because you cannot pour from an empty cup. You cannot give if you have nothing to give. So take some time out for yourself. You deserve it. You deserve the rest. You deserve all the things you tell your patients. You deserve all the things you tell your patients. You deserve it too. So do just that. You would never tell your patients to say yes to everyone, to run themselves completely dry to the ground. You would never. You would be so mad if your patient did that. So you deserve that break. You deserve that rest. So take it.
I love that. And so, where are the people to find you, Dr. Hoffman?
So you can find me on Instagram at the Woman's Health Physio. There you'll find everything. My website is still under construction, but once it's up, the link will be there in my bio for you to click on, and you can find me there.
All right. Well, thank you so much for coming on. I know I learned so much, cried so much. But really, the reason I love doing these podcasts is not just because I get to share amazing stories so that women can hear and learn and become equipped, but because I learn and grow from every single interaction. And I really, really appreciate all that you have taught me today. So thank you.
I'm happy I could be a part.
Me too.
All right.